Well, that's right. It's time now for our twice-weekly In Focus Health Update. Health reporter Linord Moudou joins us with some information on a new HIV campaign. Hello, Linord.
Hello, Vincent, and hello, everyone. Well, UNAIDS has launched a new campaign to help eliminate new HIV infections among children by 2015. It is called Believe It and Do It. The campaign also aims to ensure that mothers living with HIV remain healthy. It's estimated nearly 400,000 children become infected with the AIDS virus every year, mostly in low and middle income countries. In 2010, 250,000 children under the age of 15 died of HIV-related causes. UNAIDS officials say around 3.4 million children under age 15 are currently living with HIV. A panel of U.S. health experts has, for the first time, backed a drug to prevent HIV infection in healthy people. The panel recommended that U.S. regulators approve the daily pill, Truvada, for use by people considered at high risk of contracting the AIDS virus. Some observers say the move could prove to be a new milestone in the fight against HIV/AIDS. Truvada has been marketed for treatment since 2004 for people who are HIV positive and is taken along with existing antiretroviral drugs. Now joining us on the phone from Amsterdam to discuss these developments is Dr. George Tiendrebeogo, Senior Advisor for HIV/AIDS with the Royal Tropical Institute in the Netherlands. Dr. Tiendrebeogo, welcome to In Focus.
Hi, good evening.
First of all, tell us, can you give us a sense of the people that will benefit the most from this new drug as a prevention step?
Yeah, I think we are all excited with the evidence that Truvada can prevent further transmission of the HIV, and specifically among certain groups. You know, I'm thinking of discordant couples. That's an issue, as people realize that they are HIV infected and the partner is not. Then we didn't have a solution to that. That's a new development here. I feel, out of this population will be in Africa in a situation where you cannot rule out HIV transmission during healthcare procedures. For health personnel, that's also something to take into consideration.
And with regards to discordant couples, do you think that this could be a help for the couples that are trying to have children in terms of preventing the mother and the child from getting infected? Is there a possibility there?
Yeah, indeed. The components of Truvada some of these have been already used in prevention of mother-to-child transmission. So Truvada is, although it's a category B that has not been tested in pregnant women, both components are safe to be used. So we can expect that you have to follow the procedure. If it is we have a HIV positive pregnant woman, then likewise she's already on treatment. There's no change for that. But in discordant couple where the woman is not HIV positive, you first have to check whether she's positive or not. If she's positive, the standard procedure would apply, and Truvada can be one of the options. Yeah.
Now, many people are concerned, many people about Africa are concerned that this might not be easily accessible. What can you tell us about, maybe in terms of cost, for example?
Yeah, there are two issues here. One being technical, practical, with regard to the health system, that we'll have to learn how to prescribe who gets it. With regard to the cost as well. That may raise a new issue of what I would call a triage, deciding who would get it and who would not. That's an issue. I guess that the priority would be given to discordant couples and commercial sex workers, which is still they have to, be informed and consent. And Yeah, that's the practical issue. The second one, not the easiest one, is the social sensitivities. People are not yet, in most countries in Africa and beyond, not yet prepared to accept the sexuality of people living with HIV, which raise moral issues and human rights issues here.
Quickly, in 10 seconds, some people have worried about the fact that there will be a false sense of security. What do you say to that? Do you think people will be more laid back in terms of prevention and being more careful?
Yeah, we've already heard these allegations right away when we started developing sexuality education. It was already thought that this will encourage young people to engage in sex, which was not true. We've heard condom promotion will also, yeah. So I feel that having access to a new means should be seen as a positive thing.
Great, Dr. Tiendrebeogo. We appreciate your insight.
Yeah.
Thank you for joining us.
Hi.
And that was Dr. Georges Tiendrebeogo joining us from Amsterdam. And this was our show today.
Yeah, we have to thank you very much, as usual, for that very informative segment.
Sure.
And be sure, viewer, to join Linord Moudou every Tuesday and Thursday, of course, for health reports that are beneficial to our viewers in Africa.